Hi, my name is Noorja and I'm studying in second year in Bachelor of Physiotherapy from Marwadi University. So, today I'm going to explain what is a mental health and which factors affect mental health of an individual. So, let's start. A healthy mind is the heart of a happy life. Yes, if your mind is healthy, then your heart will be also healthy and your life is also happy and healthy because your mind matters. Now, what is a mental health? Mental health is about how we think, how we feel, and handle life's coming ups and downs. Means regular basis how we are thinking. If we are thinking in a limited, we are thinking overthinking. How we are feeling like if you are with someone, means like in a family, like with friends. They are supporting to you. They are saying something to you. Then how you are feeling and the coming ups and downs in our life. Mental health affects our relationship, work, and overall well being. Yes, because you are mentally from external and internal. Mental health isn't just about feeling good, it's about feeling whole. Now we will see which factors affect mental health of an individual. So the first one is genetic and neurological. Family history of mental illness, like in your family if anyone have mental illness like depression, bipolar disorder, schizophrenia, neurodevelopmental disorders like ADHD, means attention deficiency hypersensitive disorder, or autism, like brain injuries, trauma, stroke, infection affecting the brain, epilepsy or other neurological conditions. In second, physical health, chronic pain. If the person have chronic, the pain is too much older, or the person is too much ill, like example arthritis, fibromyalgia, hormonal imbalances, example like thyroid issues, PCOS, postpartum changes, nutritional deficiency like vitamin B12 deficiency, omega 3 fatty acids. Nutritional deficiency also create a health issues, lack of exercise, and poor physical health, which can contribute to mood disorder. Now, the second factor is psychological factor. This relate to the individual's internal thought, means how your internal thought from internal part, how you are thinking, how you are feeling, and how you behave, means your behavior pattern with others. Mental and emotional patterns, unresolved trauma or PTSD. PTSD means post traumatic stress disorder. Example like loved death of your loved one. Negative thinking patterns like catastrophizing, black and white thinking, low emotional intelligence or difficulty processing emotions, unhealthy coping mechanisms like avoidance, denial, and substance use. Learned behavior and beliefs. Perfectionism or fear of failure, means you have fear of failure, that this time I have to do this, if I will not, then you have the fear of failure. Learned helplessness, believing one cannot change their circumstances. Ingrained cultural or religious guilt related to mental illness or behavior. Religious guilt means like in your religion there is a thing, if you will do this then you will get a reward, and if you are doing against by mistake, then you will feel guilt, oh I have done this wrong. So this will also create mental illness. The third factor is environmental and social factors, external condition and relationship that impact mental wellness. Family and community, means surrounding your atmosphere, the surrounding people will also create mental illness, like parenting style, neglectful, over strictly or abusive parenting, marital or relationship stress, including domestic violence. Domestic violence like beating, if your partner is beating is also create a mental illness. Lack of community support or social isolation, peer pressure or toxic friendship. As toxic friendship, and the two words, isolation and toxic friendships. So sometimes to be alone is good as to live with bad companies. It's good for you also. Give you means me time also. The fourth one is lifestyle factors, daily habits and routines that can help or hinder mental health. Means your daily habits also create a mental health, like you are waking very late, sleeping very late, not eating nutritional food. So it will also create a mental health. First one is diet and nutrition. High sugar processed food can worsen mood, substance abuse, alcohol, tobacco, recreational or prescription drugs. So sometimes drugs also create mental health, which is not good for you. That drugs, sleep hygiene like poor sleep quality or insomnia can increase risk of anxiety and depression. Sedentary lifestyle like lack of physical activity reduce endorphins. Technology overuse means excessive screen time or social media comparison. The fifth one is situational and life events. Major events or transitions that significantly impact one's mental health, means loss of loved one, means grief, bereavement, divorce, separation, academic pressure during exams, career transitions like job loss, retirement, promotion, pressure. Major health diagnoses like cancer, HIV, becoming a caregiver for a sick or aging family member. The sixth one is barriers to help. Even when struggling, some people face challenges in getting support. During this time, some people have support, some people have not support. Stigma surrounding mental illness in their culture or society, lack of education or awareness about mental health symptoms, limited access to mental health care, especially in rural or low income areas, language barriers, or distrust in the healthcare system. Because of lack of education, the people will not see that I'm suffering from mental health. Because of language barriers, like in rural area, the people don't know how exact how to explain, how to speak, how to explain what they are suffering from. So because of this also, the mental health will increase. Your mental health matter, your story matter, and you matter. Your mental health matters. You are valued and not alone. Take care yourself and you deserve it. So thank you.